Hello, my name is Rob Puma. We're here with Carestream at AHRA 2016 in Nashville, Tennessee. I'm here with Bill Algie from Columbus Regional Hospital in Columbus, Indiana, and we're going to have a little talk about his experience with Carestream. Bill, thanks for your time, and
Sure.
appreciate you coming out. Just first question we had was, how could you describe your relationship with Carestream a little bit? You started with some DR, you have DR products with Carestream, and just describe what your relationship has been with Carestream over the last 4 or 5 years.
So we kind of started on the project of trying to move from CR to DR, and we're looking for a partner to kind of help us get through that. So had met with you a couple times and really felt like Carestream was the right methodology for us. They were looking at doing some new things and very good integration with some current products we had. So that was kind of the methodology that we went with. We first started by converting a Shimatsu portable, which was very helpful for us. Couldn't find a lot of vendors that could do that. We didn't really want to buy a totally new portable at the time. So we got some flexibility by doing that, and then also taking a Philips room that we had and converting that as well to DR. So we shared a plate between a portable and the room. And that was our first real dive into DR.
Sure.
And it's been a great relationship.
Yeah.
We've had a lot of success with the equipment, very, very little downtime, been phenomenal. And then we had a different portable that we had that was having a lot of problems. Really felt like we needed to make a change. And then obviously entertained the Revolution and showed it to the staff, let them drive it around a little bit, and they fell in love. And so that was our second purchase, was the Revolution. So that's kind of that's where we started. Since then, just recently in May, we built a new emergency room, and we just put in the Evolution.
Sure.
So we have become, I would say, fans of Carestream. It was a great transition for our staff, though, because we did one platform. The software's the same. We don't have to go and try to figure out if I'm in this room, what do I got to do? And for us, that really helped. And the fact that Carestream had a product that we were looking for in a DR room that could do the things it could do was really beneficial for us.
Great, great. On that ED expansion, it's a beautiful expansion.
Thanks.
It's a beautiful room. I love it. It's a great. I want to show pictures of it all the time. But in regards to that, what were the factors that you looked at in terms of choosing a DR vendor? I know we had a ton of conversations.
Yeah, we did.
What were the critical factors that enabled you to choose Carestream on the ED part?
Yeah, for us it was one of the main factors was we were looking for throughput. So. We went from basically having access to 4 rooms to having access to 1. Because the ED is separated from the department.
Right.
And it's separated, and it's not like separated like some hospitals, but it's a pretty far trek. So,
sure.
Actually, the ED expansion allowed us to put 1 CT and 1 diagnostic room in the ED, which has created some issues with us from a being able to staffing and that kind of stuff, some logistical issues. So we're working through those. But the big thing for us was, we wanted something that we felt was reliable. Has to be reliable, absolutely, positively, because it's the only one down there.
It's all the way by itself in the corner, and it's your ED.
And if it's down, the staff are trucking patients, back to the department, which can have a lot of issues with that.
Sure.
And we, that if we have to do that, we have to take patients back. You could have staff injuries, you could have patient injuries. The staff and patients are kind of down on a little island by themselves. So that reliability is a huge factor.
Sure.
And I think the fact that we had such good reliability with the other systems, we felt like that wasn't really going to be an issue for us. Yeah. Like I said, throughput was important, and it's still very important. We've suffered a little bit because we went from 4 rooms to 1.
Yeah.
I'm not going to lie.
The techs were shocked at that transition, I'm sure.
They were. And, it is a little slower sometimes. Not the equipment. It has anything to do with equipment. It's just that...
the amount of rooms.
The amount of rooms.
Yeah.
And I think it's still the right thing. Yeah. I think 1 room is the right thing.
Well, it also speaks to everything that all radiology directors are dealing with today is I have to do more with less.
Right. Right.
You're forced with this decision. I have to do more with less. I have to become more efficient in what I'm doing. I'm being forced by lower reimbursements, reduced staff, and how can I do that more efficiently?
Right, and they didn't give me a blank check.
Right, exactly. If you had a blank check, you could do it as many rooms as you want.
Without a blank check, we would have
exactly.
This conversation would be different.
And really, how it kind of configures around everything.
Yeah, so we were lucky enough. I mean, and Rob will tell you that we have a phenomenal room. We're very blessed to have the biggest extra room I've ever seen in my life, which is great. And it just fits in there perfect. It really works really well in there. Not because the room needed to be big because the equipment. That's not it.
Exactly.
But it just happened to work out that way.
Now that wall stand, it's on a rail behind the table.
Yep.
And usually we can utilize that with as low as 18 feet in length.
Yeah.
Yours is much longer than that.
Yeah.
But how did that play into your configuration in terms of your turnaround times and your ED, doing cross-table exams or anything like that?
Yeah, I talked to the staff a little bit before I left and asked them, kind of how that works. And it is definitely a game changer. The wall stand is a game changer, and the fact that room being a remote room, and then being able to, use the remote to get the room set up while they're bringing, while somebody else is bringing the patient in, or while they have the patient and they don't have to leave the patient. That all plays into that. The wall stand definitely plays into that.
Sure.
Now, from a positioning perspective of how the room's laid out, not the Carestream piece of the room, but where we put the control panel and the drawings that were all done originally, we probably could have handled that a little better. But it is what it is. So we're making some modifications and adjustments to take care of that. But that's not a Carestream issue. That was more of a
It's
design
all
issue for the
adjusted.
room. Yeah, it's all adjustable. But the flexibility the wall stand gives you is, you don't have to take the patient off the table and move into someplace else to be able to do cross-table laterals. You can slide them down, pull them over a little bit on the table, and you got them right there. The tube goes to, my gosh, you can do almost standing feet.
Yeah. right.
Not
Goes
quite,
all the way to the,
not quite, but pretty darn close.
Yeah.
But you do have a lot of more flexibility with that system than you do with standard chest.
Yeah.
That's for
the
sure.
flexibility of that wall stand that can tilt and angle,
tilt,
and
twist,
do the combination of the two and auto center to that is really a unique feature.
Yeah, and I did whenever we started before we opened the ED, we did tours.
Okay.
And so I did the tours, and it was my opportunity, and actually it's been the only opportunity I've had to actually play with the room. So I got about literally 2 minutes of training from one of the techs about how to manipulate the room and turn things around. And the people in the community and the dignitaries from that organization that came through were amazed at the versatility, what it could do, how quickly the images appeared. It was very, very impressive.
Great.
So.
Now, there's a lot of administrators out there who, some are all CR, some are halfway DR, halfway to digital, and some are completely digital. I actually just spoke with somebody who's completely digital and now replacing and looking. Now, what advice would you give to those individuals as they are, what we talked about, needing to do more with less, reduced reimbursement with CR now, going to DR? What advice, from your experience in this path that you've gone along here in the last few years, what advice would you give the other administrators as they go along their path as well?
Well, I think for us, I thought it was good. I think the changes in legislation is going to push people to have to do something if they haven't done anything. And I think most people, I would have ventured to guess that most people probably have a mix right now. If you don't have a mix, you're probably in trouble because you have to make a big change, you're going to lose some money. So,
sure.
But I think for us, what really helped was we kind of took it baby steps and kind of what worked well for us. The staff didn't really get this huge feeling of being overwhelmed. But honestly, if CR is not available, they don't care. They don't use it. It's not the first choice. They don't go there first.
Sure.
And so you and I'll be talking about that in the next budget year.
Sure, I'm sure.
Darn, right?
Well, yeah, and especially in terms of where they're at in their path. If they need to upgrade, they can upgrade. If they want to go new, they can go new. Whatever according to their budget, or upgrade now and then whether it be a portable or a room now, and then go new, like you're saying. 2 years down the road when you have the budget, but at least it gets you that greater efficiency.
Yeah, I think and it gets you it does definitely get you in the game, right? So you do have, that's the important thing. I think the thing too that I like about it is, we can use that one plate that we purchased and in an X-ray room or on a portable.
Right.
We do portables. We don't do a ton of portables, but it gives us the flexibility. We could share something and still make it work, and that really made a big difference for us to get it to even get started. That was huge.
Sure.
Because we couldn't find anybody else in the industry that would be able to do that.
Yeah.
So we that's why we did that. And the ability that, if we want to add another plate on there, we just have to buy the plate. We don't have to buy another piece of software.
Sure.
So if we want to, that's the great thing too. Because they're very versatile and flexible, and we can use them in different places. And even if the plate goes down for some reason, we can take the plate from diagnostic and take it down to the ED.
Redundancy. We love redundancy.
We love redundancy. We don't like the cost of redundancy, but we love redundancy.
Yeah, exactly. Yeah. And sharing those techniques. Sharing it throughout. Great. Well, thank you very much.
Sure.
Appreciate your time.
Yep.
All right, thanks.
All right, man.
Thanks until next time here at AHRA 2016 in Nashville.